Afternoon, and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us to learn about the latest local developments. I wish we were here today with better news, but unfortunately, COVID-19 cases, hospitalizations, and deaths continue to be on a troubling trajectory in our community. Today, we are reporting 111 new cases and sadly, one additional death due to COVID-19. This was a male in his 60s who was unvaccinated. Our sympathies go to his loved ones. This case data is reflected in our local positivity rate, which has increased from about 3% at the beginning of July to over 12% at the end of last week. We've also been seeing a sobering increase in hospitalizations for several weeks now. We appreciate our committed healthcare partners who have shared their experiences at these briefings. From their firsthand experience, they continue to convey to the public that our situation in our local hospitals is becoming more critical. On the left side of this chart, you can see where the situation in our local hospitals was at the beginning of July. The top gray line is the total of 7-day rolling average of COVID-19 patients hospitalized locally. The blue line is the COVID-19 patients from Lancaster County. And the orange line is COVID-19 patients hospitalized from other communities. At the beginning of July, the number of Lancaster County patients and those from other communities was really pretty equal. As you move to the right, you can see that the orange line stays fairly flat. However, the blue line, or the number of Lancaster County patients, has increased dramatically. The number of COVID-19 patients from Lancaster County has more than doubled from 30 on August 1st to 64 on August 15th. This is the highest number of patients we have seen since January 21st of this year. Today, the hospitals are reporting 83 patients with COVID-19, with 12 on ventilators. 60 are from Lancaster County and 23 are from other communities. It's important to understand that the Delta variant is driving the increases we are seeing in our community and across the country. The Delta variant is different, as I've said before. It's hitting people faster and harder, and it's causing more people to get sick and have more severe illness, particularly among those who are unvaccinated. This is not the same virus we were dealing with months ago. We've also seen the impact of the Delta variant when reviewing COVID-19 deaths over the past few months. Sadly, we've reported 30 COVID-related deaths since March 1st. 6 of these individuals were fully vaccinated, and it's important to note that 5 of those 6 deaths occurred in July and August. The Delta variant is also affecting some who are fully vaccinated. Before June, we weren't seeing many of these breakthrough infections, but as the Delta variant continues to be more prevalent, we are finding that about 25% of our new cases are in those who are fully vaccinated. As we've been reminding you, COVID-19 vaccines continue to be our best defense. The vaccines continue to provide a high level of protection against severe illness, hospitalization, and death. Most of the vaccinated individuals who contract COVID-19 are reporting mild symptoms, and some have no symptoms at all. Despite these breakthrough cases, Delta continues to show the risk of contracting COVID is still much higher for those who are unvaccinated. The case rate in the unvaccinated population is almost 4 times the case rate in the vaccinated population. The bottom line is you're more protected with vaccination than without it. The changes we continue to see happen rapidly, and we are very concerned about how our local situation is progressing. As you know, last week our COVID risk dial moved into the elevated yellow. This week the dial is moving again, now into low orange. And the orange indicates that the risk of the virus spreading and impacting our community is high and increasing. We have not been at orange on the dial since early February. In reviewing our local indicators, nearly all key metrics have moved higher. The metric for positivity rate and deaths is now in the red. The case rate and healthcare system capacity moved higher into orange. The vaccination rate remains in yellow. Only the average testing turnaround time and contact tracing remain in green. As you can see on this chart, the current position of the risk dial is in low orange, represented by the blue square outlined in red on the color-coded map just into orange. We encourage the public to review the latest guidance at the COVID-19 lincoln.ne.gov website and follow the recommendations there for low yellow. Simple preventative measures to help stop the spread of the Delta variant and protect ourselves, our loved ones, and our community. Masks are proven prevention strategy to reduce the spread of the virus and variants. Masks continue to be recommended for people in both indoor settings and crowded outdoor settings, regardless of your vaccination status. Masks are an important way to prevent the breakthrough infections we are seeing in those who are unvaccinated. And it's especially important that these groups wear masks: adults over age 65, those with underlying health conditions, and other populations at heightened risk from COVID-19. These individuals should also avoid close contact with people who are unvaccinated. If you are at risk, you may want to consult with your healthcare provider about additional steps you can take to protect yourself. Anyone who has COVID-like symptoms should wear a mask and get tested regardless of vaccination status. We also urge everyone to continue to monitor your health and be alert for fever, cough, shortness of breath, and other symptoms of COVID-19. If you have these symptoms, you should separate yourself from others and get tested, even if you're vaccinated. If you have a runny or stuffy nose, sore throat, or cough, please don't assume that it's only allergies, a sinus condition, or a cold. Many people who assume this have found out later that they have COVID-19. Most importantly, if you are eligible for the vaccine and have not yet received it, please get vaccinated now. We are not implementing a directed health measure currently, but we continue to actively monitor the impact of the Delta variant in our community. If cases and hospitalizations continue to escalate, we will need to make adjustments to our data-driven approach. The good news that we have today is that we have seen an upward trend in vaccinations since the beginning of July. This has been driven largely by our 12 to 15-year-olds getting vaccinated prior to school starting, and other adults choosing to get vaccinated due to the impact of the Delta variant. The number of first vaccine doses has climbed over 150% in a 5-week period from the beginning of July through the first week of August. During that time frame, about 15,000 people have initiated vaccination by getting their first dose. This is a shift from the slower yet steady vaccination pace we saw in May and June. We also know several healthcare systems and some employees are now requiring vaccination for employees, and that is also contributing to some of the increases we're seeing. Overall, over 69% of those 16 and older in Lancaster County are fully vaccinated, and we're edging closer to our 75% goal. All groups age 25 now, all age groups above age 25 now show that at least 63% have initiated their vaccinations. All age groups above 45 now show that at least 75% have initiated vaccination. Children under age 12 are not yet eligible for vaccination, as we know. That group includes about 52,000 children, which is about 16% of our population. The bright spot in our data shows that over 70% of 16 and 17-year-olds have been vaccinated initially. Our main concern continues to be the low vaccination rate in our residents aged 19 to 24. This is the only eligible age group that hasn't yet reached at least 50% of first doses. We also know children and young adults who are unvaccinated are contributing to the recent increase we're seeing in clusters of cases and outbreaks. We need young people who are eligible to help be part of the solution and get vaccinated to protect themselves and those they come in close contact with. Over the next several weeks, we are working with local colleges and universities to provide COVID-19 vaccination opportunities to students. This includes clinics at UNL, both City Campus and East Campus, Wesleyan, Union College, and Southeast Community College. I'd also like to provide a brief update on COVID-19 vaccine. The Centers for Disease and Control Prevention now recommends an additional dose of the COVID-19 vaccine for people with weakened immune systems who have already received 2 doses of either Pfizer or Moderna. This decision came very late last week. People with weakened immune system, like those receiving cancer treatment or who have had an organ transplant, are more vulnerable to COVID-19 and may benefit from an additional dose to ensure they have as much protection as possible. We are working with our partners on potential clinic locations, and we'll have more information to provide very soon. Some local pharmacies are now providing that additional dose as well. You may have also heard that booster doses may be recommended soon for all eligible age groups 8 months after they receive their second dose. It's being reported that this recommendation could be announced as soon as this week, and booster doses would begin in mid to late September. We are in the process of readying our plans so we can start administering those booster doses when the time comes. There is a sense of urgency to our situation. If you're not vaccinated, please get vaccinated. With the Delta variant continuing to impact our community, we highly recommend that all those unvaccinated and vaccinated wear masks in indoor setting and crowded outdoor settings. If you have symptoms of COVID, get tested and stay away from others. Once again, the guidance is posted at covid19.lincoln.ne.gov. To find a vaccination clinic near you, go to that same website or call us at 402-441-8006. And with that, we'd be happy to take any questions.
So Jared Austin for 1011, just kind of talking about this all being guidance right now. So essentially, it's all recommended just to wear masks indoors and outdoors. It's not required for people, correct?
Right.
Okay. And then just another
highly recommended.
Highly recommended, absolutely. And one thing you had mentioned is that 16 to 24 age group is at really low, or the lowest vaccination rate, around 49%. Does that really concern you, knowing that high school just started today and then UNL starting sometime next week as well?
Yes, and I think we were looking, when we looked at our 16 and 17-year-olds, we had a little bit higher age group, but it's really a lot of the 19 to 24-year-olds that need to reach that group. We're offering vaccination right now as students check in at the dorm at UNL every day this week, so that hopefully that number will increase. And they've also offered the opportunity. All students are being tested as they come into UNL for COVID, and they're also offering an opportunity for students to attend to share their vaccine status.
And so for that age group that's 19 to 24, like the young adult age group essentially, do you think there's just a lot of distrust in the vaccine, or what is, I guess, your thought process on why their vaccination rate is so low?
Some of it could be distrust, or it's really not as important to them. When I've talked to some people in that age group and other people have shared with me, a lot of it still is that they just haven't gotten around to it. It hasn't impacted their life or maybe anyone in their family, and so they don't see the urgency of getting vaccinated, or maybe understand how important it is to help bring our community numbers down.
And you had mentioned again that you're not going to have a directed health measures or anything like that right now, but if it continues to get worse, you can make adjustments and see what happens. I guess at what point will we see those adjustments when we get, to a certain point where it's time to do that?
Well, we're right now looking at all the data, and one of the things that really is, as I said, is driving us and our hospitalizations. I'm sure you're going to be hearing from Brian on Thursday, Right before I came down here, one of the health directors from another district called me, and they had had a serious car accident in their area last evening, and there was no place to send those car accident victims. We weren't able to absorb them into Lincoln, into the hospital, anywhere. And that's what we're actually seeing now, that people are being held in the emergency room. We're trying to get people in. 9 of those patients we talked about on ventilators are from Lancaster County. So this is really a very serious situation for us, but we can turn it around, and vaccination is one of those keys.
Hi, Pat. Matt Overton, Regional Star.
Hi, Matt.
Hi. Hey, so you mentioned that I think you said since March 1st, there have been 30 COVID deaths, and 6 of those were unvaccinated, and then 5 of those had come since July 1st. Can you talk at all about those people? I mean, were those all unvaccinated? Or I'm sorry, the 6 vaccinated people who died of COVID, were those all like older people with underlying conditions? I mean, is that pretty much the case?
Well, I think you remember, Matt, one of them was a 45-year-old who had underlying conditions. There have been a couple in their 60s. I'm just telling you this off the top of my head, so please consider that. That had some underlying condition, and some older adults, most recently, that were vaccinated and did have underlying conditions as well. So those 6.
Is that the same thing for most of the people who are hospitalized and winding up on ventilators? I mean, it's people, if they are vaccinated, they tend to be older, have health conditions. I mean, I guess what I'm asking you is, are you seeing healthy vaccinated people, say under 50, who are winding up, in the hospital on ventilators or dying?
No, not that I know of, Matt. We have seen some healthy unvaccinated people that have ended up on ventilators.
Right. And it sounds like, though, still, even for the unvaccinated, it sounds like most of the people who wind up in the hospital or seriously ill are older.
No, that's not the case. I wouldn't consider the death we're reporting today necessarily an older person, and that was not vaccinated and had no underlying conditions. And you'll hear many of the hospitalizations are those under the age of 60. You can look at the older adults. I hope I'm answering your question, but there are those older adults like in their 80s and 90s, and that's a little different situation, but typically what's in the hospital are people under 60.
Okay. Would you say, though, that age group you were talking about, that 19 to 24 age group that's been sort of loath to get vaccinated, they're generally not the people who are winding up in the hospital if they get sick, correct? They're just sort of responsible to some degree for the spread in the community that.
Matt, I can't answer that. I can be prepared to answer that, but I'm just trying to think in my head, looking at our charts. There are a percentage of that group, and that's one of the highest groups where we're seeing cases.
Gotcha.
Yes.
Okay, one more question for you. Do you have any explanation? I mean, Lancaster County, my understanding is Lancaster County has the highest vaccination rate in the state overall. But yet our hospitalizations of Lancaster County residents are, really high compared to where they have been. While the people from outside the community, I mean, I can remember back in November or December when pretty much half the people in the hospitals were from another county. Do you have any idea why we're having such an outbreak here, such a problem? High hospitalizations. I think we've had 9 patients die just this month. When we've got almost 70% of the population or the adult population fully vaccinated.
A lot is if we go back and we start looking at where the Delta variant started peaking, And it's those individuals that weren't vaccinated that kind of became the vectors. We had a lot of kids with daycare, summer camps, church camps, mission camps. And so what happened, if you remember when we showed you some of the cluster situations, is that ended up in having multiple family members, mom, dad, grandpa, grandma, all exposed to that. So that's what we were seeing. The other thing is, I just said that our hospitals really aren't able, they don't have the capacity right now to take many from outside our community. So yes, we're very concerned about why our number is so high, but yet we're still seeing it's the unvaccinated individuals. And I think that's telling us this Delta variant is very virulent, and it's going to spread as much as it can if we're unvaccinated.
Okay, thanks.
I just have one follow-up question. You said that there was currently 83 people hospitalized in Lancaster County. Do you know how many of those were vaccinated and unvaccinated?
I can't answer that right now, but we do track that all the time, Jared, so we can let you know. I do have to say, even on a call today, over 95% of the people in the hospital are vaccinated. Are unvaccinated. And what we're seeing in just the last month, that's an important point, and the last month that that number is about 87%. But we are seeing, even with the vaccinated individuals that end up hospitalized, they are able to recover generally. Anything else? Okay. Thank you for joining us today. And be sure and get vaccinated and wear your mask.